From Idaho's News Channel 7, this is Viewpoint.
Welcome to Viewpoint. I'm Doug Petcash. The crush of COVID patients continues to put enormous strain on Idaho hospitals, both in terms of available beds and on the medical professionals themselves. Doctors, nurses, respiratory therapists, and many others are working long hours under conditions that are emotionally and physically draining. We saw that firsthand this past week in two hospitals, one large, one small, as crisis standards of care are in effect across the Gem State. We were granted access to the intensive care and COVID units at Saint Alphonsus in Boise and Minidoka Memorial Hospital in Rupert. They're doing everything they can for their patients, but can't save them all. Medical professionals have been telling us the patients they are treating are younger now, many in their 30s and 40s, and nearly all are unvaccinated. The state is in the thick of a fifth COVID surge. On Wednesday, the state reported numbers showing COVID hospitalizations and ICU cases dropped slightly from the record levels we've been seeing. However, both categories are still well above previous totals. And this week, Health and Welfare Director Dave Jepson said we have not yet seen the peak in hospitalizations. So let's look at the numbers. As of Thursday morning when this show was recorded, the state was reporting 749 COVID patients in hospitals statewide, down from the peak of 793. 196 of them in the ICU, down from the peak of 213 the week before. Across the St. Luke's health system, 280 of their 632 patients admitted to the hospital are COVID positive. 61 of the 80 patients in the ICU are COVID patients. The St. Luke's health system says St. Luke says that 100% of them are unvaccinated in the ICU. Across the Saint Alphonsus system, though, 160 of the 484 patients admitted to the hospital are COVID positive. A spokesman tells me St. Al's doesn't release its ICU numbers, but says its primary and secondary ICUs are full and they've opened another ICU space. Also, a majority of the patients in the ICU are COVID patients. This is the first time Idaho has ever activated statewide crisis standards of care. It is a framework under which hospitals can ration care if necessary and decide who gets treatment or what level of treatment. Today, we're focusing on how the surge of COVID cases is straining Idaho hospitals. My guests are Saint Alphonsus President and CEO Odette Bolano and St. Luke's Chief Medical Officer Dr. Jim Souza. Good morning to both of you and thank you for your time during this critical time we're in.
Good morning.
Good morning.
Well, Odette, I just laid out the numbers and they paint a picture, but they're just numbers and you see it in person every day. How bad is the situation right now?
Well, I would say, Doug, that they have not improved from what you shared just in your previous slide. You know, our numbers at least are stable at this time. As you noted, we have opened up several areas. On Thursday, we on Wednesday, we opened up a new ICU. We took our day surgery area and opened it up and have patients in there. We have taken our infusion center space, converted that on Wednesday to be able to take more inpatients. And I would say, I think Dr. Drew Southard, who was on one of your shows, talked about, you know, we're trying to send people home that we would have normally admitted to, you know, care at home. Our populations are much younger than what we saw a year ago in July, June area. You know, we had sadly our youngest death from COVID this month, probably a couple of weeks ago, a 20-year-old. And, you know, when I go and visit with the nursing staff and I inquire about what's the age, and they're all between 30 and 50, early 50s. So I think our hope is that people are listening and acting accordingly. We are still one of the lowest vaccinated states in the United States. So not much change from what you saw last week.
Dr. Souza, same question for you. How bad is the situation right now?
Similar story. We're on a really high, really not pretty plateau in terms of hospitalizations. We're, you know, hovering in the ballpark of 300 a day. We have seen it not rise for about a week, and we're trying to take a hopeful signal from that. But similar story, you know, new units opened, staff redeployed from operating rooms and ambulatory sites to support working in new places and in different ways, doctors from ambulatory sites pulled into the inpatient setting to support the work. The patients are definitely younger. Our average age of patient in the hospital is 58, down from about 72 in the December surge. And in our adult ICUs, our youngest patient today is 22 years old. About 70% of our patients are 55 years or younger in the intensive care unit. And in the intensive care unit, 25% are younger than 40. They're sicker. They're staying longer. Average length of stay in the ICU is up by 2 whole days, and their mortality rate is significantly higher than it was in the December surge.
The government and agencies just came out with some guidance for pregnant women, urging them to get vaccinated. What do you have to say about that, and have you had tragic situations there involving pregnant women at St. Luke's?
Thank you for that question. I really appreciate it. Absolutely. I think both of us on this call have seen this. Some of our most tragic cases have been young moms and their babies, and we've lost moms and we've lost babies. I'd remind everybody that pregnancy is a natural state of immune suppression. That is specifically how moms carry, right, foreign tissue and don't reject it. So that immunosuppression in pregnancy is playing out, and we're seeing really tragic cases.
Odette, how is your staff holding up after 18 months of this and now the worst surge we've seen?
Yes, I can tell you that every day we're on calls, right? I spend probably 3 hours a day talking about one piece of what we're going through and how we're planning. I can tell you that our hospitalists are extremely stressed. I can tell you that our nurses are discouraged. They see and they want to be here to serve the community, but it is really difficult for them to continue to see the misinformation, the challenging people that are coming into our organization, challenging our policies, our safety practices, the anger that we're seeing in the community. I mean, we obviously have begun to see it reported in the news. It's interesting to watch that they were heroes maybe a year ago, and today they feel totally unsupported by the community in a large part. And yet when I walk those halls, those people they're doing the good fight, right? They are here for this community. They want to be here, but to be carrying all this on their shoulders and being disrespected when they're following the science, they're trying to ensure that the organization's serving the community. Mm-hmm. It is really difficult. I think right now, and Jim probably can speak about this at St. Luke's, we're starting to talk about moral distress. Yes, there's burnout, and we see increased burnout, but moral distress is very, very different. And so how do we really support our staff when they're having moral distress on top of burnout?
So, yeah, Dr. Souza, do you want to address that particular point?
Sure. I mean, what our frontline staff are going through right now is it is the most profound and unrelenting volume of suffering and death that most of them have ever experienced. And I think for many, these are actually the worst days of their professional careers right now. And there's a parallel between the smothering sensation of the patients and a bit of that kind of smothering and helplessness that our staff and our providers experience. When you move from, just understand that from their perspective, they're not trapped in the world of statistics and numbers. Mm-hmm. They're in the world of individual stories, and they are tragic. Parents of young children dying, young adult children of middle-aged adults dying, middle-aged adults in the prime of their life dying, and almost all of it preventable. plus the sort of false narrative and that's driven by misinformation that they hear, the resistance they feel. We've never experienced anything like this in our healthcare profession.
We've been hearing stories about doctors, nurses being, basically threatened by the families of, the patients, the COVID patients who want them to try some of the other treatments and whatnot. Have you had to increase security or change anything because of situations like that?
So I'll answer for you. I mean, in our freestanding EDs, we definitely have increased our security when we have concerning situations erupting, or we think that they're going to erupt. We do have security on standby. I can tell you that with the stories that have aired nationally, and the story that was shared about a physician here in Boise, people are very concerned about coming to work. I would say that our emergency room, they're here to take care of anything and everything that walks through that door. But the concern of the staff of what is going to happen when somebody walks through that door, based on the anger that they have been sensing for months now, is pretty alarming. So security is at a heightened state in our organizations to make sure that we're making the staff feel a little bit more comfortable about what they're dealing with. They're not only dealing with the emotional issues of the family and being caretakers, but now they're worried about potentially their safety and aggressiveness. And then that spills over to what their families are dealing with when their loved one goes to work every day at St. Al's or St. Luke's or one of our, the clinics or other hospitals in our community.
Similar situation for you and your staff, Dr. Souza?
Yes, increases in security, increases in signage to set expectations for, folks entering these spaces, and some new processes to more rapidly escalate help so that we can de-escalate the situations. Yes, same story.
Before we get to break, I do want to ask you about surgery, elective surgeries and things like that. Are you doing any of that right now, or people having to wait?
So we have a very detailed process that we are looking at. I would not call any surgery elective anymore. They might be time sensitive. And so we are reviewing that on a pretty regular basis. I mean, including cardiac surgery, right? We are sometimes having to delay cardiac surgery because we feel, based on bed capacity, the capacity in the ORs, what we need to be able to provide, that patient may be able to wait a week. And I don't know how any of you feel, but I don't think anybody wants to get a call either about an oncology surgery or a cardiac surgery that we're going to have to allow you to wait for a little bit until we can make sure that we can fit you into the schedule and have a bed and have the staff ready to care for you.
And Dr. Souza, are you able to accept patients from other hospitals now, or are you still struggling also to send patients out to other hospitals?
We do accept patients from other hospitals when we can. Saint Alphonsus does too. The collaboration, frankly, with all providers around the state, trying to load level and just get patients into a bed where they can receive care, has been fantastic. But the answer to your question, honestly, is it depends. Depends on the day and the hour of the day, and it's constantly and ever changing.
Thank you. We're going to take a quick break here, and coming up next, we'll talk a little bit more about crisis standards of care and how the role of a healthcare leader has changed during the pandemic. Stay with us. And welcome back to Viewpoint. Today we're focusing on how the surge of COVID cases is straining Idaho hospitals. My guests are Saint Alphonsus President and CEO Odette Bolano and St. Luke's Chief Medical Officer Dr. Jim Souza. Dr. Souza, the state has activated crisis standards of care, and I just want to clarify, is St. Luke's operating under them now, and how are you handling that?
Thanks. Yeah, we are. I mean, it's important to understand like what that means.
Right.
What it means is that the quality of care that people have experienced has deteriorated, that we haven't been able to keep up. And, just for some examples, right, to meet the demand of acutely ill patients, we have to redeploy clinic staff and OR staff. So now we can't provide the same amount of care in those units. And that means people who need certain surgeries, as was discussed in the last segment, women with uterine bleeding, some people with cancers, those are postponed. We've had to shift staff to patient ratios. We've had some real equipment challenges with BiPAP devices. We've had to repurpose NICU ventilators to run them on adults. And the list goes on and on. So, with all of that, our standard of care has eroded, and we came into this with really high standards. I've been using this latte metaphor to try to help people envision crisis standards of care. And there's really kind of two layers in the crisis. I think all healthcare systems in Idaho, I don't want to speak for them all, but I believe we're all in this first layer. So we've already eroded access to care. We've already had challenges to quality of care, and we do not want to get to the second layer. In the first layer, it's all about extending your resources to more patients. So that's going to, involve the things that I just mentioned. It also involves, and we touched on this aggressive real-time load leveling. In other words, like in our system, if a patient in Nampa needs an ICU bed, they may find themselves in Twin Falls. Alternatively, a patient who presents in Boise with a simple pneumonia and needs a med-surg bed, they might find themselves in Mountain Home or Haley. And the metaphor is, you can think about it this way. It's like we were giving everybody double shot lattes. And what we're doing now is we're giving less to more people. So we're giving everybody a single shot latte. Mm-hmm. The second layer we do not want to get into, but we're prepared to do so, is where we actually start allocating or reallocating or deallocating resources from some to others. And that would involve actually looking at multiple patients and determining which ones are most likely to benefit from the resource and give the resources to them. Yeah. And if you use that latte metaphor, that would preserve a single shot latte for some, but give milk to others. Got it. And we don't want to go there. We don't have to go there.
Well, it is good to hear that we're not there at this point. And Odette, with this being said, how has your role as a president and CEO, changed over the course of the pandemic, and what are the biggest challenges that you're faced with?
Yeah. So my role has changed significantly, right? I think I spend maybe 3.5 hours of literal time in meetings talking about all the things that we have to do, coordinate, I resolve issues, identify issues, support the staff. I've always been big on rounding. It's a different kind of rounding, right? It's not about, hey, how can I make your life better? It's like, hey, how do I support you during these very, very difficult times? It is about shifting, quite frankly, our strategic plan of all the things that we have planned for this community and how to serve this community to a pause. It's about knowing that in our ambulatory areas, we are delaying care for people that need preventative care, that we want to make sure don't get to a situation where their condition becomes acute and they have to come in and maybe not get the best care because they waited too long. It's about consistently and continually communicating. I can't even count the number of town halls that we've had over the last 18 months, individual conversations, supporting people in their darkest days, dealing with the anger that maybe some of our teams have, the need for leaders to be out there supporting them when they're dealing with very difficult situations with families. or visitors. I don't go to bed without thinking about COVID. I don't wake up without thinking about COVID. It really is remarkable how we've had to just really totally shift to what 30 or 40% of our population in our hospitals is consuming probably 150% of our time.
And how about for you, Dr. Souza? How has your job changed compared to what you were doing 18 months ago?
Yeah, thanks. Completely. All the work on, work that healthcare leaders want to get after, redesigning care and innovative new ways to create access and help people live healthier lives. That's all stopped. And my job has become two things. Internally focused, as Odette said, to do everything I can, everything we can to take care of our people. Thank them, appreciate them, hear them, acknowledge what they're going through, ultimately bring resources for some sort of a recovery period that we are going to need in U.S. healthcare. And then this externally facing piece, and thank you for the opportunity today to let us keep telling our story, where we're trying to influence changes in public perception and public behavior to help put an end to this. That's how my job's changed.
We just have a short amount of time left. So Odette, I guess the final question for you would be, what message would you like to leave with the viewers today?
Yeah, so my message is we really need your help. We're here to serve you. We will always be here to serve you. We are not proud that we are, as health systems across Idaho and actually around the United States, where we are. We pride ourselves in the quality of care that we give. We pride ourselves on our staff being compassionate and graceful and making sure that they're doing the best they can. So we need your help to really follow those safety precautions, to urge you to get vaccinated. I was sharing earlier, we are one of the lowest vaccinated states. We're in the circle with West Virginia, North Dakota, Wyoming as the lowest vaccinated states. We want to get back to all the things that we want to do. We've canceled Festival of Trees for the second year in a row. What unhappy time it is to go into the holidays in this state. So please help us to get vaccinated. And I would urge everybody to use grace, compassion, and understanding when you're walking through our doors.
I'm going to leave it right there. So well said. Thank you so much for sharing those sentiments. Dr. Souza, thank you again for your time. Odette, it was great to meet you, even though it is through Zoom. And thank you for your information and your message to the viewers.
Thank you.
Thank you.
I'll be back to wrap things up. You can find more of our reporting on the COVID situation on our website, ktvb.com, as well as comprehensive graphs on COVID numbers and trends. Another great resource for numbers on people vaccinated, cases since the beginning of the pandemic, hospitalizations, and the COVID trends is the state's coronavirus.idaho.gov website. The Saint Alphonsus and St. Luke's websites also have dashboards on COVID hospitalizations and other COVID health information. That is all of our time for this week's Viewpoint. Thank you so much for watching. I'm Doug Petcash. I'll see you tomorrow on Wake Up Idaho and right back here next Sunday morning for another Viewpoint.